Imagine this. You've fought breast cancer, you've gone through surgery, you're about to face radiation, and your doctor tells you there's a surgery that can greatly reduce your risk of a lifelong, painful condition called lymphedema, from 40% down to just 10%. But there's a catch. Your insurance company has to approve it before it can be done, and if they say no, you could be left with swelling, pain, and permanent disability for the rest of your life. In just a moment, you're going to hear the actual recorded call between the patient surgeon and the reviewing doctors for the insurance company. But before we play it, I want to give you some important context. The surgery in question is called lymphovenous bypass, a delicate microsurgical procedure that connects lymphatic vessels to tiny veins, helping fluid drain normally and preventing the buildup that causes lymphedema. For patients facing breast cancer treatment that includes lymph node removal and radiation, the risk of lymphedema can be devastatingly high. This procedure can drastically lower that risk. Yet, as you're about to hear, approval isn't automatic. In fact, it's part of a much bigger, nationwide debate about Medicare Advantage and the growing use of prior authorization, the process where your insurance must approve your care before you can get it. Advocates say it's there to prevent unnecessary procedures. Critics argue it delays or denies necessary care. Listen carefully to this real peer-to-peer call. Notice the questions asked, the answers given, and what that might mean for any patient who finds themselves in the same situation.
Hello, this is Dr. 𝗶𝗶𝗱𝗆. Who is this? Who am I speaking with? Can you not, there's also another 𝗲𝗏. So you have two doctors on the call. Will either of you give me your name or MPI number or license number? The reference number for the call, but you won't give me your name or number, and neither will the doctor from Texas. Okay, please give me the reference number. Okay, and is the doctor from Texas? Would that person speak up, please? I'm good. Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty, so. You're an oculoplastic surgeon. What was your initial training in? So we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct? Oh, okay. Still practicing, but you won't give me your name? But you're my colleague in plastic surgery, and you won't give me your name. Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Like, how do I verify that? I'm just trying to make sure that I'm talking to an expert in this procedure with training that's commensurate with that. How do I verify that? So I can get your name from United Healthcare through this reference number. I'm so sorry that this is to protect you as a doctor. I'm really trying just to do the right thing as a patient, and I also personally have been subject to threatening communication as well. I just want this to be the right thing. Okay, so I'm just gonna have to trust you. You were asking me as a representative of United to trust you that you're a plastic surgeon and fellowship trained in microsurgery. So, okay, I'll trust you there. So do you perform lymphovenous bypass? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? Even one? You have not. Okay. Do you treat patients with breast cancer currently and do microsurgery like deep flaps or lymph node transfers or lymphovenous bypass? You have a cosmetic practice currently. Okay. Okay. Do you do microsurgical? Okay. Do you do microsurgical breast reconstruction currently? So you're not doing microsurgical breast reconstruction currently or treating patients with lymphedema currently. Okay, so the patient that we're talking about is a physician, and she is going to have an axillary dissection and radiation, and her risk of lymphedema is, I'm assuming you know. Do you know? Do you know what the No, it's important. The specifics are important. Do you know the specific risk? Like the documented risk for her? Like the percentage risk of lymphedema? No. She absolutely will need radiation. If she's having an axillary dissection, she's going to have radiation. No, so she's been to see us in clinic. She's had further evaluation. She is going to be having an axillary dissection and will need radiation. So do you know what her risk of lymphedema is? Well, I mean, I think if this is part of the issue. If you're my peer, then I think you should be able to answer that question, because that's an important statistic, certainly for my patients who have lymphedema. So her risk of getting lymphedema is 40%, and we have the ability to reduce that to 10% using a lymphovenous bypass. And that's the information that I want you to carry back to United. And I will do the appeals and all of that. But that's the piece of information that I want you to have going forward. So you don't have the ability to approve it in your role. Okay, this patient I'll appeal. Again, I appreciate your time. I don't think you're my peer in this area. I don't think that you had the specific details around this procedure. You haven't performed it yourself as a primary surgeon, and you're not actively treating these patients with microsurgery. But I appreciate your time and calling, and I'll continue to reach back out to United. You too, thanks.
If you're on Medicare, especially Medicare Advantage, or you're helping a loved one navigate it, stories like this are a reminder you need to know your rights, you need to understand how prior authorization works, and you need an advocate who will fight for the care you deserve. That's why I make these videos, to help you stay informed, prepared, and empowered. Subscribe to this channel, watch my other videos on Medicare and prior authorization, and share this with someone who needs to hear it. And if you have questions about your own Medicare insurance or need help reviewing your options, reach out to me directly. The link is in the description. Your health decisions should be made by you and your doctor, not delayed or denied by red tape.